just know that there's more than one way to achieve your goal, to achieve a new range of motion, to achieve a new strength, to achieve a new posture.
Welcome back, everyone, to another episode from the Optimal Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today our episode is all about scoliosis, that curve you might see in the spine. What is it? Why does it happen? And what are some things you can do to start addressing that? All right, diving in on scoliosis today, and this is actually our second episode on scoliosis, and Jen is our honorary scoliotic individual because she does have a little bit of a curvature in her spine. We're going to tell a little bit about her story and dive a lot more into what scoliosis is and what you can do. But before we get to that, please consider hitting the subscribe button and also that notification bell so you can keep up to date on all the episodes that we release, all the other amazing videos Jen does on mobility, movement, and pain disorders. Comment below, do you have any questions about scoliosis or really any other topic you'd want to see us do an episode on? Because we do so many of these things and we need to know what you want to know. So now let's get into scoliosis and what we can actually do about this curve in the spine.
We want to really break down, just some understanding about scoliosis, and especially when it's related to pain, because that's when we usually hear it brought up a little bit more, like, oh, I'm in pain. It must be from my scoliosis. Let's dive into that.
And that's really why anything becomes important to us on our day-to-day, like once it starts causing symptoms, right?
Yeah.
Yeah, or the image might actually make us start thinking certain things and feeling certain things even more. It may amplify it. And so like, what is scoliosis? I think everyone who knows what scoliosis is or has heard of it knows it's some sort of curvature of the spine, right? Because when you look at the spine from the back, it should be a straight line for the most part, right?
Yeah.
Quote unquote. And we call scoliosis this lateral curvature of the spine, but that's not it, because the spine doesn't just operate in one plane. So if we just measure it from looking at the back, oh, yep, there's a curve laterally, we're not fully doing that justice because the spine operates in every single plane.
Yeah.
So when we get that lateral
shifts and it rotates.
Yep, we get rotation of the vertebra too. And so it's actually more of like this spiral curve that we start getting in the back.
Yeah, and we could have varying degrees of scoliosis, and varying places exactly where the curve is. And this is why almost anything you look up, or like whenever someone comes to me and it's like, what do I do for my scoliosis? There's not one answer, because scoliosis is so specific to the individual. It is so specific to the person because it's based on how much curve you have. It's based on how much rotation you have. Where is this curve happening? Is it happening only in one spot? Is it happening in multiple areas? There's so much nuances from individual to individual that if you tell someone that you have scoliosis and they say, I know what to do for you.
Yeah, start doing this, and this. Like,
I'd be a little worried.
Be a little concerned because they don't know anything specifically about you.
Yeah.
And
if that's your goal specifically is to address the scoliosis, well then.
Yeah, because we have, these three major areas of the spine, like the cervical up by the neck, thoracic, which is kind of in the chest area, and lumbar, which is down in our abdominal region. And we can get these varying degrees of scoliosis in one or multiple areas. And for the majority of people who have scoliosis, it's what we call idiopathic, which when we hear idiopathic or anatomically idiopathic scoliosis, AIS, that basically just means that we don't know the underlying cause, or we don't know why this has happened. And when we look at each individual, again, like our body might adapt in that direction or in that pattern of scoliosis that we're getting for so many different reasons, because we all move differently. We all have different tugs and pulls and muscles that are going to be more active or less active. So that's why we call it idiopathic, because we can't really say like, oh, it's these two muscles that are tight, or these, it doesn't work that way.
Always doing something to one side, say a throwing athlete, right?
Yeah.
Always going to the right side, a kicking athlete. We have these different tendencies that we've built up within our body, and based on those continual pulls and continual need of our body to go in one direction, we could start developing some differences. And this is why it's even quote unquote normal, right? Well, pretty much. And this is even what we learned in PT school. Oh, you're right-handed, your right shoulder is going to be lower. that's normal. And that is like a classic sign kind of some functional scoliosis is we see some uneven shoulders. We might see some differences in your sides. We might see around your rib cage, we might see like more of a prominence on one side more than the other, or even from the front, you might notice, like, especially for a woman, that a chest, maybe it looks and appears that one breast is bigger than the other because of that curve and that rotation of the spine.
Yeah, and coming back around to like when this becomes important is when people feel pain, or people tend to start feeling pain, or it's affecting their daily activities. And there was a study that we looked at that's imaged a bunch of people, and 31% or around 1/3 of the people who had measurable scoliosis were presenting with back pain. So again, many people who do have scoliosis, like yourself, don't have consistent back pain symptoms.
Sometimes when people hear, oh, you have scoliosis, don't load the spine, which is insane to me.
Yeah, don't load the spine, which means don't ever carry groceries, don't ever pick up your child, your dog. Yeah, don't pick up anything.
Yeah.
Don't stand or walk or go upstairs.
Because the moment you stand up, you're loading your spine.
Yeah, so it's really hard to hear that as like a primary recommendation. The question is like, what next? Like, there's conservative treatment options, there's bracing, or there's surgery.
A lot of times surgery is really not recommended, and you can get so much help from conservative treatment, especially if your goal is function and pain.
Okay, what can I do to start supporting my body better, supporting my body differently, addressing some of the back pain or symptoms I might be feeling, and become empowered within that? Because there are so many examples of people that do live with significant curves that have very minimal or no symptoms and live very functional, purposeful lives. And kind of one more thing on the surgery conversation is there was a study that showed,
that was a good one.
You know, there were a lot of people that did get surgery, and basically what surgery is, it's stabilization. So they fuse, they either put rods in, most of the time they put these rods in the portion of the back that had the curve, and they fuse it for a stabilization surgery. And the research kind of said, like, in the immediately after the surgery and the initial recovery period, there was some benefit for different pain measurements. But on a 20-year follow-up, there were clinical findings and clinical significance to reductions in function and increased pain. And there was a decent number of people that actually had to have a secondary surgery or another surgery.
And what we've seen, so there's this particular method that people who have scoliosis may have heard of.
The Schroth Method.
The Schroth Method. And I mean, really, ultimately, their goal is trying to create that spinal awareness, that spinal stabilization, and try to prevent the furthering of your scoliosis and your scoliotic curve. And they do this a lot through postural positioning and really using some awareness techniques of where my body is in space. So if my pelvis is tilted, what does it feel like to come into a more neutral position? What does it feel like to try to traction and elongate my spine and put it, quote unquote, back into a straight neutral position? And then how do I use my breath to kind of control where my rib cage is and that spinal curvature? And they use different push and pull methods, again, depending on where this curve is and what's happening. But there has been really good results, like continuously, with using this method. One example was like looking at a 5-year-old, and it was like, even after a 8-week progression of this, like how much improvement just looking at his body had made. Wherever you are, if you're listening, say you're even driving, you can still do this. So if you were to kind of sit up, I wouldn't like sit back, but kind of sit up, and you can even just reach one arm forward. So think of your shoulder blade kind of pressing forward. Don't round into your spine and don't like turn your body, but just think of reaching that shoulder blade forward. Now hold that position, maybe even push the back elbow back or the back arm back.
So if you're driving, make sure you keep your knee on the steering wheel.
Make sure the passenger is doing this. Yeah. Okay, so as you're pressing back and down with one arm and then forward with the other shoulder blade, take a deep, deep breath from the side of the rib cage. So breathing in, breathing out, and try to hold those positions even further. So reach forward, reach back. Try it again. And what you kind of notice there, or maybe hopefully, is as you breathe in, you might notice a little bit more attention to the shoulder blade that was kind of moved forward, the arm that was reaching forward, because we get a little bit more space where we can move the back of that rib cage and the sides of that rib cage. We get a little bit more mobilization in the front of the rib cage on the other side, right? So we start to kind of move and mobilize that rib cage just by doing breathing. Looking at this Schroth.
Schroth.
Thank you.
Nailed it.
Schroth Method and Pilates. Many of us know Pilates a little bit better, right? We're thinking of that core stability. We're thinking of almost that dancer-like movement with some of this core control. That's what I think a lot of people think of Pilates of. And they did both of these. They measured it at the end for the Cobb angle, actually did reduce in both.
In both of them, yeah.
Yeah, in both of them, which is amazing. But still, the Schroth method was just a little bit more effective at decreasing that angle of the curve.
Which makes sense because it's more specific. And
exactly.
The people are like specifically tailoring the exercises to address, where those curves are. But I like that it shows that Pilates could be effective too, because a lot of what Pilates does is it brings awareness back to the body.
Yeah.
And it brings awareness back to positioning.
Yes.
And again, like, if you've listened to any of our podcasts, we are not posture or position obsessed. We don't believe there's one specific posture everyone needs to be in, because everyone's body's slightly different. And especially in a scoliosis, example, like the curve may never go away. The curve may never reduce. But again, if we can connect more to those different positions, ability to control into those positions and go into them more consistently throughout the day and feel safer and move more freely amongst them, like that's the goal. So that's where I feel like modalities or classes like Pilates or yoga, different types of yoga could be very effective in helping connect you more with the areas and ranges of your body you struggle with, but also help you safely explore them.
Basic treatment protocol that they kind of wrote out based on a case study looking at someone in pain with scoliosis. So they kind of went through 5 phases. The first phase was really, okay, how do we create relaxation within the body to get those spasms down?
Step 1, calm it down. It's always the first step.
And just do some passive range of motion, which we actually did a podcast all on back spasms before. So you can listen back, and we talk about a lot of relaxation techniques to help with that. Phase 2 kind of ran into wearing a brace and also getting some manual treatment. Now, we've also talked about manual treatment. All that's going to do is start to talk to our nervous system to help to relax muscles so that we can get back into functional movement again.
It's almost like phase 2 of calming it down. Like then you get somebody who can apply some manual treatment to really calm down the areas of the body that have so much tension in them. And that can be very valuable to then move into phase 3, which is where we start to develop some of that core stabilization ourselves, where we explore different pelvic positionings.
Or from our diaphragm, that inner core that we always talk about.
Yeah.
And then going into just some activations, like how do I connect to my core when I'm doing exercises that are more focused on the front, so laying on my back, and how do I connect to my core even going into more of a back extension, but still maintaining this diaphragm pressure, this pelvic floor, like how do I connect all of this and doing different front and back movements. And then they go into phase 4 where they say, okay, now let's start kind of stretching our extensors, getting things to calm down. So all the way from the neck to the back, doing some forward and lateral bending and going into more range of motion.
Yeah, continuing to progress the range of motion, part of the equation. And then stage 5 was strengthening. Yeah. Starting to strengthen within that, find good functional strength, a lot of scapular stability, which is, a lot of shoulder blade movement. What we were just showing you, or that example, was kind of using scapular protraction on one side, pushing that shoulder blade forward, scapular retraction on the other side. You can do elevation and depression and go opposites.
We have to get strength within our body. We have to start moving things differently. So that's ultimately what's so important. I think sometimes we get robbed by, we're thinking, oh, I have to go to this person because they're going to put me back into place. Well, make sure that they're giving you an active treatment to get yourself, quote unquote, back into place. We're not out of place. If you're moving, if you're doing life, you're not out of place. Your body is just pulling in different directions, which isn't necessarily and always a bad thing. We can still create stability and strength on these curves. When we build strength upon our body, we create safety within our body, and we're saying, hey, you're strong, you're safe, you're stable. And that always has progressive layers to it and might look different from person to person, but also there are so many different methods to scoliosis treatment.
Yeah, I mean, you got this Schroth Method, and I feel like the Schroth Method sounds very similar to something like postural restoration. PRI, also different, just like PNF techniques, like proprioceptive neuromuscular facilitation. There's other things, and these aren't even scoliosis specific, the ones I'm listing off now, but they're just things that help us explore the different tugs and pulls on our body, explore where we might be tight in our muscular system, in our nervous system, and how that might be developing different tightnesses. There's also different scoliosis specific certifications like the Leon, the C's, BSPTS, DoboMed, Side Shift, Fits. So there's all these different techniques that people might have certifications in. We didn't look in specifically to what each of those do. But again, like my intuition would say a lot of them are basically helping facilitate us to get into the ranges that we're uncomfortable in. And then how do we find stability within those and the ability
build
to
that awareness in them.
Yeah, build awareness in them and operate slightly more functionally within those ranges.
And there's probably others that we didn't name, so don't come at us, okay? There's so many out there. Every time we talk about scoliosis, I have someone say, oh, well, did you try this method? That's the best method. And again, if it's best for you, I'm so happy for you.
Yeah, these methods wouldn't exist if they didn't work for someone.
Exactly. So just know that there's more than one way to achieve your goal, to achieve a new range of motion, to achieve a new strength, to achieve a new posture. Thanks so much for joining us on another episode. I hope you enjoyed that one. I know we didn't give specifics about what to do for your scoliosis, but hopefully we helped you bring awareness back into what you can do. And if you want some guidance on that breath work, on mobility, on stabilization, we have all of that on Gen Health. So come check out a free week. We're going to drop the link below if you haven't yet. And of course, if you have further questions or comments, drop them below and let us know.